This is Professor Jones. You're looking at the anterior and posterior views of the skeleton of the human body. Please become familiar with all the bones. You have a handout as part of section 1 underneath the bones section where you can actually print out a diagram of all the names of the bones. Please notice especially the sutures in the skull and the pelvis. Those sutures have formed solid bones by the time you have gone through puberty. The next slide that you're coming to is the generic joint. I call it a generic joint because every joint actually has a slightly different formation. This one you can see the two ends of the two bones that articulate to form a joint. One end is concave, which is the bottom joint, and the top joint actually has a surface that we call convex. As those two bones come together, the cartilage sits between them to actually cushion the joint. You can also see ligaments on the sides of the joint. The ligaments hold the two bones together. And there's a synovial membrane surrounding the joint that houses synovial fluid. If that membrane is punctured at all, that synovial fluid escapes, which actually gives us inflammation of the joint. Here you can see some more of the parts of a joint. Some cartilage is called hyaline cartilage. You find that cartilage underneath your kneecap. If this was a knee joint, the cartilage that is called fibrocartilage is actually at the knee joint called meniscus. And the articulating cavity, of course, is where the two bones join together to form a working joint, worked by the muscles of the joint. And the muscle having two ends called tendons, so tendons are actually a part of a muscle, will attach from one bone and cross over the joint to attach to the other bone, which actually is what causes movement. As the muscle does its work of contraction, it will move the bones. And here we have the three planes of the body where movement happens. The A is the sagittal plane, divides the body into right and left halves where the actions of flexion and extension occur. Flexion is actually moving your body toward fetal position. Extension is the return from that. B is the frontal plane, where your body is divided anteriorly and posteriorly, so front or back. The movements that happen here actually look like sideways movements. They're abduction and adduction, and also lateral flexion of the spine. C is the horizontal plane, divides your body into top and bottom or superior inferior sections, and the actions of rotation happen here.